Right now, there are four medical bills that millions of American seniors are paying every single month that they are legally allowed to stop paying. Not lower, not shrink, stop. And here is the part that should make you angry. The people collecting that money know exactly who qualifies to stop paying, and they are never, ever going to call and tell you. One of these bills is coming straight out of your Social Security check right now, before you ever see the money. One of them is the reason your prescriptions cost what they cost at the pharmacy counter. One of them, and I need you to hear this clearly, is a bill that in certain cases is actually illegal for anyone to send you at all. And they send it anyway, and people pay it. And the fourth one, the one I am saving for last, is the biggest bill in all of American healthcare. And there is a form sitting in a drawer at your local hospital that can make it disappear. Study after study says roughly 1 in 3 older Americans who qualify for these protections never claim a single dollar of them. 1 in 3. That is not because they don't qualify. It is because nobody ever sat them down and told them the door was open. Now, before you decide this video is not for you, let me stop you right there, because this is exactly how people talk themselves out of their own money. Some of you are thinking, I have savings, I own my home, these programs are for poor people. Wrong. Some of these protections have no asset test at all, and one of them applies to every senior in the country regardless of income. And some of you are thinking the opposite. I live on a small Social Security check. Nothing good ever applies to me. Also wrong. 2 of these were built specifically for you, and the income limits are higher than you think. I am going to give you the real numbers for this year, not some vague phrase like low income. So whether you are 62 or 92, whether your house is paid off or you rent a 1-bedroom, watch all 4 before you decide any of them is not yours. And let me answer the question I can already feel coming. If this is real, why has nobody ever told me? Here is the frustrating truth. These programs pay out what you apply for. There is no person in the entire system whose job it is to look at your situation and say, you know what, you qualify, let me sign you up. That person does not exist. Your doctor's billing office does not check. Medicare does not check. The hospital does not check. The bills go out automatically and the exemptions sit behind forms most people never see. The system is perfectly happy to let you pay for the rest of your life. Today, we fix that. My name is Raymond. I have spent more than 15 years working through the fine print of these programs, sitting across the kitchen table from families and reading the rules line by line. I am not selling you anything today. I do not work for the government, and I do not make a dime whether you claim these or not. I just read the rules so you don't have to, and I tell you in plain words what they mean for your money. Let's start with the bill you have probably stopped noticing, because it disappears before your check even lands. Bill number 1 is your Medicare Part B premium. If you are on Medicare, you are almost certainly paying this. It covers your doctor visits, and it comes straight out of your Social Security check every single month before the money ever touches your bank account. In 2026, that premium is a little over $200 a month. Read that again. That is more than $2,400 a year quietly pulled out of your check. And because you never see it leave, most people forget they are even paying it. Here is what almost nobody is told. There is a set of programs called Medicare Savings Programs, and if your income is under the limit, your state will pay that premium for you. Not reduce it, pay it. Which means the $200 and change stops coming out of your Social Security, and your monthly check goes up by that exact amount. For a lot of seniors, that is the single biggest raise they will see all year, and it does not come from Congress. It comes from a form. Now, who qualifies? This is where I need you to stay with me because this is exactly where people hang up on their own money. For 2026, depending on which version of the program you look at, a single person can have monthly income up to somewhere around $1,800 and still qualify. For a married couple, the line runs up into the $2,400 a month. And here's the part that surprises people. A number of states no longer count your assets at all. Your savings, your paid-off house, they do not disqualify you. So do not sit at your kitchen table and decide you make too much. Let the application do the math. Think of a widow. I'll call her Ruth. Ruth is 74, gets a modest Social Security check, and every month a little over $200 of it vanished for Part B before it ever reached her. Ruth was certain those programs were for other people, poorer people. When someone finally ran her actual numbers, she was under the line. Her state took over the premium, and her check grew by about $2,400 a year. Nothing about Ruth changed. Somebody just showed her the door was open. How do you claim it? One phone call. Your local state health insurance assistance program. People call it SHIP. They are free, they will screen you, and they will help you apply. You just say, I am on Medicare, I am on a fixed income, and I want to know if I qualify for a Medicare savings program. That sentence is enough. And here comes the warning I will repeat all through this video, because this kind of money attracts thieves like a porch light attracts moths. The moment word spreads about a benefit, the calls start. Someone official sounding says they are from Medicare, they can get your premium refunded today. They just need your bank account and your Medicare number. Stop. Hang up. Medicare does not call you out of the blue to hand you money. You go to them. You never give your numbers to whoever called you. That was bill number 1. The next one follows it around like a shadow, and most people who qualify for the first also qualify for this. Bill number 2 is what you are paying at the pharmacy counter. Your prescription drug costs under Medicare Part D. Your plan premium, your deductible, your copays, all of it. There is a federal program called Extra Help. Some people know it by its other name, the Low Income Subsidy. And if you qualify, it can dramatically cut what you pay for your medications, down to a few dollars per prescription, and it can take your drug plan premium and your deductible off the table. For somebody taking several prescriptions a month, and I know that is many of you, this is not pocket change. The government's own estimates put the value of Extra Help in the thousands of dollars a year. Thousands. For pills you are already picking up anyway. And here is the piece that should make this a no-brainer. In a lot of cases, getting approved for that Medicare savings program from bill number 1 enrolls you in Extra Help automatically. 2 of the biggest health cost breaks in the entire system, unlocked by 1 phone call and 1 application. This is why I told you to call SHIP. While you have them on the phone, you ask about both. Say the words Extra Help. Say the words Medicare Savings Program. Let them check you for everything at once. Who does this help the most? Anyone living mostly on Social Security who takes regular medications. If that is you, this program was written with your name on it. And every month you don't apply is a month you paid the pharmacy money the law says you didn't owe. Now, bill number 3, and this is the one I told you about at the start. The bill that in certain cases is illegal to send you, and gets sent anyway. If you qualify for the most generous version of the Medicare Savings Program, the one for the lowest incomes, it goes by the initials QMB, something remarkable happens. It does not just pay your Part B premium, it wipes out your Medicare deductibles and your copays, all of them. And here's the part almost nobody knows, including, frankly, a lot of the billing offices sending the bills. Once you are enrolled in QMB, federal law prohibits doctors and hospitals from billing you for Medicare deductibles and copays. Prohibits. It is called balance billing, and for QMB enrollees, it is against the law. But here is what happens in the real world. The billing computers do not always check. A statement goes out after your doctor visit. It lands in your mailbox. It looks official, it has a number on it, and you have paid your bills honestly for 60 years, so you write the check. You just paid a bill that was illegal to send you. And nobody comes to correct it, because the system corrected in your favor is a system nobody is paid to run. So here's your move. If you are enrolled in QMB and a bill for a Medicare deductible or copay lands in your mailbox, do not pay it. You call the provider's billing office and you say these words: I am a QMB enrollee, and federal law prohibits balance billing me for Medicare cost sharing. Please correct this bill. If they push back, you call 1-800-MEDICARE and report it. And if you already paid bills like this, ask about a refund, because in many cases you are entitled to one. Think of a man I'll call Frank. Frank is 78, enrolled in QMB, and over 2 years he paid almost $900 in copay statements that were never legal to send him. Nobody stole from Frank in a dark alley. They mailed it to him, and he paid it politely. When his daughter finally caught it, the bills stopped and the refunds started. The only thing that changed was that somebody knew the rule. That is bill number 3. Now stay with me, because bill number 4 is the biggest of them all, and the form that erases it is the one hospitals talk about the least. Bill number 4 is the hospital bill itself, the big one, the one that arrives after a fall, a surgery, an ambulance ride, a few nights in a bed, and lands on your kitchen table with a number on it that stops your heart a second time. Here is what almost nobody tells you. The majority of hospitals in this country are nonprofit hospitals, and under federal law, nonprofit hospitals are required to have a financial assistance policy. People call it charity care. In plain English, if your income falls under the hospital's limits, they are required to reduce that bill, and in many cases, wipe it out completely. Zero. And the limits are higher than you think. This is not just for people with nothing. Many hospitals reduce bills for households earning 2, 3, even 4 times the federal poverty line. A retired couple on Social Security and a modest pension can land inside those limits without even being close to what anyone would call poor. But here's the catch, and by now you can say it along with me. It is not automatic. The hospital does not check your income before mailing the bill. The bill goes out at the full sticker price to everyone, and the financial assistance application sits in a drawer until you ask for it. The billing department will set up a payment plan with you for years, happily, without ever once mentioning that the form down the hall could have made the whole thing disappear. So here is exactly what you do. Any hospital bill, before you pay $1, before you agree to a payment plan, you call the billing office and say, "I would like to apply for financial assistance under your financial assistance policy. Please send me the application." That is it. They are required to have one. And this works backwards too. Many hospitals will apply it to bills you already received, and some will even revisit bills already sitting in collections. Picture a woman I'll call Dolores, 81 years old, 3 nights in the hospital after a fall, and a bill for $14,000. She was ready to drain the savings she and her late husband spent 40 years building. One application later, based on nothing but her income, the hospital wrote the entire bill down to zero. $14,000, erased by one form she did not know existed until somebody told her to ask. Now let me add all 4 of these up, because when you see them stacked together, it lands differently. The Medicare Savings Program, more than $2,400 a year back in your Social Security check. Extra help, thousands a year off your prescriptions. The QMB billing protection, hundreds more in copays and deductibles you legally do not owe. And charity care, the power to erase the biggest medical bill of your life. For a lot of you watching, that is not pocket change. That is the difference between a retirement where every month is a white-knuckle squeeze and one where you can finally breathe. And hear this part clearly. The seniors who claim all of this are not smarter than you, and they did not earn it more than you. They found out it existed and they filled out the form. That is the entire difference between them and the 1 in 3 who never see a dollar. Now you know it exists too. Before I give you the final piece, so many of you have asked, so I will mention it once. Everything I cover on this channel, the benefits most seniors never claim, the exemptions, the tax breaks, the exact words to say on the phone, I put in one plain English guide called the Wealth Alert Playbook. The link is in the description. But everything you need to start on all 4 of these is right here in this video. So here's your homework, and none of it costs $1. This week, one call to your local SHIP office. Ask them to screen you for a Medicare Savings Program and for extra help, both at once. If you get approved for QMB, from that day forward, no doctor or hospital bills you a Medicare copay, and you know exactly what to say if one arrives. And the next time a hospital bill lands on your table, yours or someone you love's, you do not reach for the checkbook. You reach for the phone and ask for the financial assistance application. And remember the warning. The government will never call you to hand you these benefits. Nobody legitimate charges a fee to sign you up. You go to them. You never give your information to whoever called you. Because here is the truth underneath all of it. Nobody is going to knock on your door and hand you what you are owed. The system is quietly built to keep collecting from the people who never ask, and it will happily let you pay these 4 bills for the rest of your life if you let it. The only person who is going to make sure you keep every dollar with your name on it is you. If this opened your eyes, do one thing for me. Send it to one person you love who is over 65, especially someone who just got a medical bill they are quietly worried about. They may be sitting on thousands of dollars a year they have never once heard of. You can be the reason they finally find out. Subscribe, turn on the bell, and I will see you in the next one.